So we wanted to know, is there anything that parents of newborns can do to keep their babies safe?
CBS 13's Anjali Hemphill is getting answers.
Hello! As measles cases spread, so does concern at local daycares after at least 5 infants at a Chicago area daycare tested positive.
The fact that these children were under the age of 1 and thus unable to obtain the vaccine truly underscores the urgent need for every single parent out there to ensure that their child is vaccinated.
The infected babies are too young to receive the measles vaccine, which put them at high risk for contraction if exposed.
We're watching our children all the time, daily well checks as they enter and throughout the day.
But Julie Jenkins Sathey, executive director of Caring Connections Children's Centers in Sacramento, says she won't turn away any children who aren't vaccinated.
I have high regard for people's personal philosophy and beliefs to not have that treatment. On the other hand, it's a risk.
But are there any steps the state has taken to make kids safer? Since January of last year, California parents are required to provide immunization records or a letter from a healthcare provider that says they received counseling on the benefits and risks of choosing to opt out.
We always, especially now, we want to make sure that they go to their physician, get good advice, and make sure that they're making an informed decision.
But some parents who have kids in daycare that aren't old enough to get the measles shot are still concerned.
I think it's worrisome. You can't quit your job and just decide to keep your kid home. So I guess it's something that we all have to deal with unless we decide to pass laws that require kids to be immunized.
The Placer County Health Department emailed a letter, and it says if your child has not received the measles vaccine and is exposed to the disease, they may be excluded from attending school or child care to prevent the spread.